Good evening. You're watching The Urban Debate with me, Avni Raja. We are now just days away before the big COVID vaccine drive kicks off. Now, as per the latest briefing from the Health Ministry, 13th of Jan is when they will be ready to start the drive. But of course, the final date still has to be announced. But meanwhile, one mega dry run was already conducted across the country a few days ago, and another one has now been planned on the 8th of January as well. Now, all of this is to ensure that the entire vaccination drive goes off smoothly. If there are any loopholes, to try and plug all those loopholes before the actual vaccination process begins. Now, over the last few days, there have been a lot of developments as far as the vaccination drive kicking off is concerned. While some of the questions and concerns over the process of vaccination have already been addressed, there are still a lot of questions on all of our minds right now. From who is eligible to the process of vaccination, what about vaccination for people with other health issues, vaccination of our children, concerns over the vaccine itself. All of these questions are extremely important and our top focus right now. And in fact, over the next 1 hour, that's exactly what we're going to try and do, is to get all of your questions and concerns, whether it be over the vaccine itself, whether it be about the vaccine process, whatever the question, we're going to try and get those questions answered. We've in fact got a fantastic panel of experts who are here with me to answer all those questions. So all you have to do is pick up your phones and call in on the number that's flashing on your screens and get those questions answered. Let me first introduce the panel I have who will be taking your questions. We've got Dr. Raman Gangakhetkar, former head epidemiology and communicable diseases of the ICMR, Dr. Rajesh Parikh, Director Medical Research, Jaslok Hospital, and author as well, the coronavirus book, Dr. Narendra Gupta, public health expert, Dr. Anand Bhan, researcher, global health bioethics and health policy, and Dr. Rajiv Seth, senior pediatrician and medical director, Child Health and Development Center. Thank you all of you so much for joining me on the show today. But before I get to our guests and we start taking your calls, there are some basic questions that we can tell you, and in fact we can answer for you at the beginning. So let's go across to Aarti, who will help us understand the answers to some of those questions in the beginning.
We're just days away from the mega vaccine rollout, and I'm sure all of you have plenty of questions about the modalities of this rollout. I'm going to try and answer some of them. Now, what is CoVIN app? This is something that you're going to hear very frequently in the coming days. It is an app that the government is going to be using to consolidate the people who are actually getting the vaccine, their information, their data. It is an intelligence network app is what it's being described. And it's a digital platform to monitor the vaccination drive. Essentially, if you're a private citizen who doesn't fall into any of those categories like healthcare workers, frontline workers, you're not in the priority group, you can log on to this, you can register with your details, the government can get in touch with you like that, and it will essentially be a monitoring platform for the vaccination drive. What is the status of CoVIN app? Well, the answer is that the app has not yet been launched. We're still awaiting information from the government when that app will be launched, and then when users and all of us can perhaps share our details there and log in and provide our information to kick off things. The next question is, who will get the jabs in the first phase? The answer is the priority group. Who are the priority group? It's healthcare workers, frontline workers who of course have been risking their lives daily in this entire pandemic. And after them, citizens who are above the age of 50 years old who have comorbidities. Now, what are those comorbidities? To answer that, there is actually a committee that has been set up to determine what comorbidities will be included in that list, under which comes under the priority categories. Who needs to self-register on the CoVIN app? Well, all beneficiaries except healthcare workers and frontline workers will need to. So for example, if I need to get the vaccine, I will have to register on this app to enroll myself for the process. Is registration on CoVIN mandatory? Yes, it is. It is. It's a nodal intelligence network, so to speak, where the government is looking to streamline the process. So unless you're a healthcare worker or a frontline worker, you will have to log in and you will have to register yourself on this. Can you register for the vaccination on the spot? No. You can't turn up at a vaccination center, stand in a queue and hope to get the jab. That's not going to how it works because, of course, just given the large-scale rollout that we're going to be looking at, the government is looking to streamline the process and you have to register yourself before you actually get vaccinated. Well, finally, how are you going to get the vaccine? It is going to be an intramuscular injection, like a number of immunization drives have. It's going to be an injection. It's going to be a jab. Now, in the days to come, I'm sure there are going to be plenty of queries about the process. There are going to be plenty of queries about the rollout, and we're going to try and answer as much of them as we can here on Mirror Now.
Well, that was Aarti there telling us what exactly about the CoWIN app. That is one important point that needs to be mentioned here because the app has not yet been officially launched, so it's important for all of you to know that you shouldn't try and download any of the apps, any CoWIN app that you might see right now because they are not authorized, they're not been officially launched by the government as yet. But we'll get to all of that in just a bit. Let me first start off by going across to Dr. Raman Gangakhetkar at this point in time. Dr. Gangakhetkar, thank you so much for joining us. The first part, of course, is the first dry run has been completed, across the states. We're going to see a second dry run going ahead on the 8th of Jan as well. Your sense of how much this has helped in sort of streamlining the entire process?
I think that's very crucial. When you are going to run such a mega operation across the country, one must try to learn as much as possible as to what are the key challenges that you are likely to face when you actually start rollout. And for that, already they have done one dry run in 4 states, and then the second dry run was also done on 2nd of January. Now, at each dry run, you tend to improve your SOPs. You tend to improve the standard operating procedures. I'm sorry, used jargon for that matter. But then once you start improving, you tend to come to know what you have written as SOPs, as ideal SOPs, how best can you translate them into a reality? And that would be feasible, perhaps in the last run that you will do.
Okay. All right. In fact, we've already got a lot of questions that have started coming in. I'm going to, dive straight into these questions, and I'm going to keep coming across to all of you. But meanwhile, if any of you feel that a certain question that you would like to take, please feel free to let me know. Let me start with the first question that we have is that why is India waiting for 4 weeks between the 2 Covishield doses when UK is waiting for 12 weeks? That is one question that has come in from one of our viewers. And let me, in fact, go across at this point in time to I beg your pardon. Let me go across to Dr. Parikh here in terms of how you can answer that question.
Well, the right thing to do is to wait for 4 weeks instead of 12, because that is what has been tested. When the studies have been done on the vaccine and the extensive studies, the dosage between the two has been 4 weeks. So that's a time-tested dose. Now, in the United Kingdom, they're actually doing a lot of strange things which have not been tried before. So one is this 12-week interval, and they're doing it for logistic problems. They want to try and administer the vaccine as many people as possible, and therefore they've kept a 12-week interval. They're also doing or trying to do another thing which is very strange, which is mixing vaccines. So they might give you the first dose from one vaccine, and 10 weeks later, 12 weeks later, there might be a dose from another vaccine. This is, again, not been tried before. So the policy that our government is following is the one that has been time-tested and proven to be both efficacious and safe.
Okay. Okay. Dr. Anand Bhan, if I can come to you for the next question here. After a person is tested COVID positive and recovered, how long should one wait before getting vaccinated?
Thank you. So I think as of now, there is no clear guidance on this. I think the expectation is that if you've been tested positive and you're in your isolation period, it's best that you stay that out. And while we are not doing any antibody tests, etc., before vaccination, I think the routine advice right now is for everyone to get vaccinated who falls into that eligibility list. At a later point of time, if there is a change in that, depending on your immunity, because you might have some antibodies due to the infection, then that might be updated. But because the antibody levels can also be variable across infections, some of us have mild infections, some of us have serious infections. I think it's safe to say that even if you have had an infection, you should go ahead and get vaccinated, but obviously not in the period when you might be infected.
Okay. Dr. Rajesh said, I want to come to you here because this is obviously one issue that is extremely important to everyone in terms of vaccination for children. Now, at this point in time, it is not something that is going to be done. But there are a lot of questions coming in as far as vaccination for children is concerned. What is the advice, or what is it that one should know about it?
Childhood vaccination is the only thing that which was covered with the universal immunization program. Unfortunately, our children will have to wait probably till middle or even late of 2021, because right now the researchers need to examine the dosages. Firstly, you need to see the dosages, you need to do the safety, you need to do those trials which have not been tested in children. This vaccine is for adults for now, and for children over 15. Now, a child is a child till 18 years of age, by the way. So, the younger children will not get these vaccinations for a while. Right now, it's very unclear because the research is going to happen. And I think we'll have to wait. So let's not talk about children right now. As far as young children are concerned, we'll have to wait for the research and approvals. When that happens, then we can give you a very clear instructions, because not only the dosages in children could be different, it could be also the duration of the booster shots could be different, and it may take many months for us to realize what is a great dose. So please, I would say just wait about it. Good part is most of the children have minor illnesses. 70% of the children who have COVID are really asymptomatic, and out of the total COVID cases, only about 7% or 8% is the ICMR data that occurs in children. The problem in children is, as a very good point you have raised, is not the direct effect of COVID, it's the indirect effects of COVID. So I think while this focus is going on in adult vaccinations, what we have actually done, our own research here, is that in the communities after the lockdown, people stopped giving childhood routine vaccinations, which are part of the universal program. And so there is a very high probability that our children were going to get vaccine preventable diseases. So parents should be told that you must complete your routine vaccinations, while they are waiting for COVID vaccine. COVID is not the only disease in children. There are many more life-threatening diseases. And so our data is showing that children are likely to get vaccine preventable disease. Also, because of the indirect effects, most of our Anganwadi are closed. The government schools are closed, where the poor children were getting their midday meals. So children are suffering from malnutrition. There's a data to show that malnutrition has increased. Also anemia and other comorbidities that children will get. In fact, there are some data that will say that the indirect effects of COVID will increase the child morbidity and child mortality. And therefore, while we are preparing for adults to get these shots, it's very important to focus on children and focus on their importance of their basic nutrition, their health, and other parameters which are very important for their routine development.
Yes, absolutely, Dr. Seth. The extremely important points that you've raised over there, especially one that requires parents to know not to stop the other vaccinations that need to be given to children, especially to the younger children as well. Let me, in fact, also go across to the next question, which says that when will Maharashtra government arrange door-to-door visits to prepare a list of senior citizens and those with comorbidities and other eligible for vaccination, like Gujarat has already done? I'm just going to sort of expand this a little bit. Dr. Gupta, if I can come to you here, just to talk about the process that is going to be followed here. Of course, Gujarat has started it off, but what is the process in terms of trying to figure out who are the people who will be part of the first phase of the vaccination drive?
See, already been declared by the government of India that initially the first lot would be the health workers. It includes everybody, and they would be about 100,000 people. That is what they are expecting this number to be. Then the next would be other frontline workers from the Department of Police and from the local bodies and administration, even from army, paramilitary, and so on and so forth. And after that, that the third group would be the one which is above 50 years. Within that, then there are certain classifications as been explained earlier. There will be first preference for the people with certain comorbidities. Within comorbidities, again, there will be preference for certain kind of people. So all those things have been worked out, but the listings have been done so far as I am aware of is of the healthcare workers. That listing is complete, and it is very easy also to do it because they are all mostly already known. They are the people who have been working in this area, so they are already aware about this. The process about the listing of these frontline workers also is going on, and I think once that listing is complete, then the third listing of these people above 50 years and with comorbidities would begin to happen. But certainly it's going to be a challenging task because it's not very easy, because the data about the comorbidities is not maintained. It will be easy for people who are above 50 because we already have a certain identity systems here, especially the Aadhaar, which has the list of people. So that will be easy to do. But the next thing would be to again categorize them into people with comorbidities and otherwise. That will be a difficult task, and the task would become far more difficult once we get into the villages.
Right.
Once when we get into the villages, and especially villages which are far off from the cities, like tribal areas or areas in desert or areas in hills and
Right.
all these places, it will be quite a challenging task to get to those places and find out about their status, health status, in
Right.
terms of them, in terms of vaccination. So it's going to be a hugely challenging task for India. And I think the best approach should be when we get to this third list of above 50 years, that time we have to build some kind of a more nuanced approach in terms of where to go first and when
Yes.
to go last.
Yes.
And this
Yes.
first and last would be based on the data which we already have about the people who had COVID, like hotspot area.
Yes.
So if they had hotspot areas, we should prioritize those areas first and then move on to other areas. That is the way we, plan out our vaccination program for the country. I think
Yes,
we'll
absolutely.
be
Dr. Gupta, I completely get your point in that after the first phase, it's going to also be crucial how the rest of the phases are conducted and choosing who would be eligible and when. But we're getting calls at this point in time. Nirmala is calling us from Bengaluru. Hi, thank you so much for calling in. Go ahead. What's your question?
Yeah, thank you. Good evening to everyone. I have two simple questions.
Yes, please
Hello?
go ahead. Please go ahead.
Yes, I have two questions. One is, as a senior citizen, how do I decide to choose which vaccine, if at all I'm given a choice? How do I select which is the best vaccine for me? That is one question. The second question is, the CoWIN app, is it, if whatever data I register in it, where does it go? Is it authorized, or is it, I really don't have no idea when to register in it. I know how to register this because I'm sure the app is very well designed and developed for that. But when do we register? How safe it is? These are my questions. Thank you so much.
All right. Thank you for calling us. Dr. Ganga Khedkar, if you'd like to take the first question that she says in terms of how does one select which is the best vaccine? Here, obviously, we're assuming that we're going to have a choice sometime in the future, but initially, it's not going to be a choice.
Absolutely. So to begin with, we won't have as much of choice because one of the rate limiting steps is going to be the ability of any vaccine manufacturer to provide adequate dosages. And the result is you will first go to those who can produce you, give you that many dosages. So essentially it would be based on what is available. So that issue will perhaps not arise to begin with. And as the process, as the time will pass by, you might find that there could be different vaccines. But there are few issues which we must remember. People tend to get excited with differences in efficacy of 2%, 1%, and things like that. No, when it comes to 90%, 92%, 94%, we need to remember that these small differences are going to become less and less important when it comes to the real life as such, because these are essentially, we call it as effectiveness, no longer efficacy,
Right.
because you are giving it in the field. So please don't go only by those differences. You may have to wait for any adverse event to emerge, which could be very serious if that is a consideration. But so far, what we understand, the adverse events are not so high, because today you have almost immunized more than 1 crore people, and the rarity with which the side effects are occurring, one should feel that perhaps those may not be observed. But as the time passes by, we will have more information to decide based on that. But as of now, you have very little choices than what is available.
Okay. We've got another caller, Jason, calling us from Mumbai. Hi, Jason. Thanks for calling in. Please go ahead. What's your question?
Okay, I wanted to ask the panel that how safe is the COVID vaccine, and is it safe for people with comorbidities and who are on steroids and immunosuppressants?
Okay. All right. Let me take that question to Anand Bhan. Anand Bhan, if you can address that question here, because we do know at this point in time there is a panel, a committee that has been put in place which is examining which are the comorbidities that will be included in the first phase of the vaccine drive. But please go ahead.
Yeah, thanks. That's a good question to ask. I think, as these vaccine candidates have been going through clinical trials, and primarily phase 1 and phase 2 is something which both vaccines we're talking about right now have gone through. We know that safety has not been a major concern. There have been obviously some adverse events, but not a huge amount. So these vaccines seem to be relatively safe. That having been said, these are early days, because they've just gone through the early stages of testing in phase 3, and then continuing on into when you actually do phase 4 is when you realize longer term safety of any vaccine candidate. So yes, you need to be cautious, but I think it's safe to assume that the events should not be very common. These will be relatively rare. On the question around what kind of care should those with comorbidity take, I think the committee will probably clarify that. There have been cases with some vaccines, like the Pfizer one, where those with a history of allergy are potentially at higher risk of having an adverse reaction. And so I think the committee will also probably put out some guidance around who needs to be careful in terms of going for vaccines where they might potentially be at risk of an adverse event, and that should help clarify. Otherwise, I think it's also a function of what has been tested in clinical trials. Often clinical trials have only healthy volunteers, might not have all kinds of participants with comorbidities, and so we might not have enough data, but over time that will be collected. And that will, for example, also include pregnant women, lactating women, who are, I'm sure, also very interested in getting vaccinated. But in the absence of data, we might not be able to start off with them. We might start off with those who are probably more healthier and or non-pregnant, and over time also introduce the vaccines for those with these kinds of conditions.
Right. Dr. Wan, since you mentioned pregnant and lactating women, what about those who are in high risk sectors, who are working in high risk sectors, or frontline workers, women who are either pregnant or lactating? How will they be dealt with?
Yeah, so I think the hope is that we will have data soon. You're absolutely right. There are, it is not a good idea to exclude anyone. In fact, now there is a global movement to try to include pregnant women and lactating women, including in research. For a long time they've been excluded from research, but I think there is now a realization that women who are pregnant or who are lactating have different physiological changes as compared to non-pregnant women or non-lactating women, and it's important for us to understand how vaccines or indeed even drugs work with them. So I think over time we will find out. While precautions are taken often in clinical trials, also you end up having some women who get pregnant who were clinical trial participants, and so indirectly you get some data.
Right.
So I think as more data comes through, I think we should be able to know also whether it's safe to use with pregnant women, and hopefully it will be made available to them if that is the case.
Okay. Let me go across to Dr. Parikh. Dr. Parikh, the other question that our earlier caller had with respect to the Covin app, again, this is a question that a lot of people have. What happens to the data? Is it safe? What is the entire process? If you can address that for her.
Well, I am not sure on how safe it is. One can assume that it will be reasonably safe. Also have some respect for 12-year-olds and 13-year-olds who can hack into any system, government systems in the world. But on the other hand, what is there in that data that we should really be worried about? The data is going to carry whether you're eligible to get the vaccine or not, and whether you got it or not. So I wouldn't worry too much about the security part of the app. And once the app is launched, it will be amply clear how one should register for it.
Okay. All right. And we've also got a lot of questions coming in terms of how the vaccine is actually going to reach you. Those are also some of the questions coming in. So let's, in fact, take a look at this on what is that entire process? What are the steps before the vaccine actually reaches?
In fact, that's one of the key questions that that viewers will also have in terms of how exactly is the vaccine going to reach them. So we have charted out, and the government has in fact given an entire process which will be followed in terms of actually transporting the vaccine from the manufacturing store centers to the vaccination centers. The first step, of course, it is that it will be transported by air to 4 key centers which have been identified, which includes Mumbai and the national capital as well, where the vaccine will in fact be transported to from the manufacturing firms, from the manufacturing centers. The next step that will be followed, of course, that it will be transported from those 4 centers to states where the vaccine drive will actually be conducted. The third point, of course, being that these are then going to be transported to district stores, and finally from there they will be sent to the public healthcare centers, and lastly to the vaccination centers in these individual states. Now remember, there are at least 20,000 cold chain links which are there, which will be part of this entire process, not just in terms of storage of the vaccines, but also transportation of these vaccines in these vans which are going to carry it from each center to the final point of the vaccination center. So it's extremely important that because remember that the vaccines have to be stored at a temperature between 2 to 8 degrees. So it's very important that this entire process is neatly done. That was one of the things, of course, that the government wanted to test out in the vaccine dry run that they conducted a few days back. And now this entire process has in fact been chalked out and given to the state authorities as well in order to ensure that it goes smoothly and there are no hurdles that is faced in this process.
All right, well, that's a process that's going to be followed before the vaccine actually gets to you. But phones are ringing at this point in time. Vinay Kulkarni from Mumbai is with us on the phone line. Thank you so much for calling in. Go ahead. What's your question?
My question is that if the vaccine of my choice is not available when I go to take it, will I be given an opportunity to wait till that the vaccine of my choice is available?
Okay, that's a good question. Let me go across to Dr. Gupta here to answer this. Dr. Gupta here, this obviously taking the vaccine is going to be a process where you can choose to either take it or not take it. But how would you answer this question?
Yeah, this is really an interesting question, and this is the question which has emerged for the first time, though vaccination had been in this country since a very, very long time. There have been polio vaccine, there had been measles vaccine, DPT vaccine, every vaccine. Never this kind of a question has been raised that which company's vaccine whose child should get. This is the first time. So this is becoming a very interesting, and it is becoming more interesting essentially because now lots of information is getting generated because we are in a new era in which there lots of information which moves from here to there, and then all kind of information is in open domains where talk about it, discuss about it. The point here about the vaccination is that one should not have that kind of a mindset in that I have to take a particular kind of vaccine, because the basis on which a person decides that I want to take this particular vaccine is based on based on not something of which that person is fully aware about. So or she has to take believe into the system which system is providing. Nobody is, I think, questioning. I don't hear where the vaccination has already started in UK and US and other countries where people have been demanding, no, I'll have a Moderna vaccine or I'll have Pfizer vaccine. Such things we don't hear.
Right.
So this question should not be, promoted and should not be talked about, because vaccine if given and the government is in a way trying to assure that the vaccine given to you is a safe vaccine with efficacy and cities, then this kind of question should not be taken up.
All right, we've got Sudarshan joining us from Mysuru on the phone line. Sudarshan, thank you for calling us. Go ahead, what's your question?
Hello, my question is, a person who has recovered from COVID, will it be equal to a vaccine, or does he need a vaccine once again?
Okay, all right. Let me go across to who would like to take that. Dr. Seth, if you would like to take that question.
That.
Please go ahead.
I suffered a very life-threatening bout of COVID, and I have a great antibody levels as of now, 3 months. But these antibodies are not likely to stay forever. And so it is very clear in the guidelines that those people who've had COVID will also get these injections and COVID injections. You never know. You see, we are in the learning stage here. My colleague who got COVID, by 3 months, his antibodies are all gone. And our seropositivity rate in our country is about 25%. Now, the whole idea of giving this COVID vaccine to a mass is because we want to create a concept called herd immunity. What happens? 35 to 50% of Indians will have to have significant COVID antibodies levels. Then only we get a COVID herd immunity. And then we will be able to be causing an end to this pandemic. And that's what we all want.
Right.
You see, at this point of time, there are a lot of questions which people will continue to have. But I think these questions will have answers, and clear answers will evolve over a period of time.
Right, absolutely. Dr. Gangakhaidkar, I just want to take that point forward, and ask you this. Does that then mean that people will need to keep getting vaccinated, say, on a yearly basis, like how in other countries as well, they have regular flu shots on an annual basis that you have to keep taking? Will that be something that will be needed to be done?
Can I answer two other queries and come back to what you are asking? And if I forget your query, please remind me again.
Sure. Please go ahead.
Just one thing, there was a legitimate concern that somebody expressed that if I submit certain documents, how safe they will be.
Yes.
Now, what one can do, to my mind, is not submit those documents which you think can be utilized for wrong purposes. Let me put it this way: a ration card or things like that, or electoral card. Now, as long as it has a photo, it just doesn't matter. So you may save your agonies with respect to submission and the anxiety that may come. Second issue was, if I'm currently infected, when should I take the vaccine? One of the issues that we need to remember, you don't need to take it immediately, because all of us know COVID-19 disease in itself is going to lower your level of immunity. The take of vaccination, that is, successful vaccination, would require a stronger immune system. Therefore, we don't know about the reasonable period of waiting, but it could be between 2 weeks to 3 months time, wherein you could take the vaccine. Now, I still remember your question. Now, if Oh, what did you say?
The
If
question,
I had,
sir, the question was whether people will need
yeah,
to keep getting
yeah,
vaccinated. Just taking forward the earlier point you made, whether it's something maybe you'd have to get done on an annual basis, or more than that. How would it work?
Hello. You don't need to think about it as of now because we don't have robust evidences. That's number one. Number two, there was a question which also came up on certain related issues, so perhaps everything will become apparent. One thing which is important, if you want to have a durable response that lasts for a longer time, you should have T cell sensitization, T lymphocyte sensitization. By and large, in infections, T cell sensitization tend to occur. And when you provide vaccines also, there are certain vaccines which have actually demonstrated in their publication that T cell sensitization did occur. Now, T cell sensitization protects you. After some time, after you get the infection or a vaccine, the titer of that antibody may start falling down. But your body tends to remember that certain infection came and how did I fight with that infection through this T cell memory that we tend to have, so that next time when the organism comes, you straight away start producing the weapons, the antibodies against it. So T cell sensitization, does it occur in all? Currently, the data is showing some kind of a hope that it does occur, but we do not know fully as to how long will this provide to me durable protection. So the clean answer that I can give, we don't have data, but at the same time, it's unlikely to be annual flu-like shot based on what we understand today.
Okay. All right. Those are some extremely important points that everyone should be aware about. I want to go across to Anand Bhan on this next question here. With regard to, I want to go back to the entire, of course, now it has settled down, but the controversy over the Bharat Biotech vaccine and Covishield that we saw in the last few days. Now, the question is, as far as the Bharat Biotech vaccine is concerned, the kind of nod it has been given is as if it's a clinical trial. But Covishield is going to be given like a regular vaccine. So, in one sense, you're talking about the Covaxin vaccine, where it will be recruiting people for the placebo. So, how is it, ethically, how does one look at it to recruit somebody for a placebo who might otherwise be eligible to get the actual vaccine?
Maybe it would be helpful to clarify that, for both vaccines, the approvals which have been given are special approvals in restricted emergency use. Because we don't still have enough data sets for both vaccines. So these are exceptional, approvals that you give in pandemic situations. For Covaxin specifically, they have added on language, as you rightly said, which says in clinical trial mode. Now, part of the challenge is trying to understand what that means, and one is hoping that the regulator will provide more clarity on that. But it's likely that there will not be a placebo arm. It will probably be a single arm study, which is to say that these will be all participants getting the vaccine candidate, but they will be monitored intensively and data will be collected. So it will be what is typically called a single arm study and probably an observational study where people are tracked post-vaccination. What is hopefully going to happen is that the ongoing phase 3 efficacy study, which is indeed a randomized controlled with a placebo arm, will continue and we will get sound efficacy data from that. And on top of that, you will have this additional data being collected from the rollout in clinical trial mode.
Okay.
So you don't need to worry about being in the placebo arm if you are in that rollout phase. Okay. Because that's probably not going to be there, but we'll have to wait and see for that announcement.
Yes, absolutely. Still a lot of clarity on that front as well. Dr. Gupta, if I can come to you, we've got a whole bunch of questions that have come in as far as the entire registration process is concerned, the expected time gap between when you actually register and the vaccination. If you can just give us, a sense of what that process is going to be like.
As I could gather and understand that the process would be, since vaccination is something which this country had been doing all along, then this country also has a well-planned public health system, starting from the primary healthcare up to tertiary healthcare. Within primary healthcare system also, it is based on population, means all different kind of institutions are covering certain kind of population. So almost every family of the country is being covered by one subcenter. Every family of the country is under certain community health center and subdivisional hospital. And all this primary health system which we have in India, its most important activity has been so far vaccination only. So they are quite accustomed and very familiar with the whole system of vaccination plus registration. In fact, all kind of apps are already there for tracking pregnant women for their antenatal care, for their vaccination, for their tetanus toxoid shot. There is an app for children below 2 years who have to be given all different kind of vaccines, and reminders are given through those SMSs over the phones. So all those systems are already laid out. This is different because this vaccination is not for children and pregnant women. This vaccination is for adults. So we have to enroll adults. Then adults are not have not been thinking about vaccination, and this is the first time that they would be asked for it. So the first and second round of the vaccination, which will happen with the healthcare workers and frontline workers, would be rather easy, because for that you need not to reach out to the peripheral sites, because the number is small. So you could do it at a subdivisional level, or you could do it at a 4-5 places within a subdivision.
Right.
But once you reach to the third stage, the registration, and after registration, the vaccination, you have to reach out to almost, if not to every village, but to a couple of villages or 3 villages, because the number of people above 50 years would become quite big. And then there's already this this vaccination has to be done with not large number of people coming to one vaccination site. So every vaccination session has to be, planned out in such a way that people with small numbers only come for the vaccination there.
Yes.
And this is not a single shot vaccination. See, then we also have to have a second dose of vaccination. And you have to have a second dose of vaccination. You have to keep following it up. So the tracking of people who have given first shot and no adverse effect is there is also very important. And then all these vaccines would also cause immediate discomfort to the people in terms of likely fever, in terms of the site and all those kind of things. And about 30 to 35% people in this country, especially in rural areas, are more or less illiterate.
Yes.
So they believe into these things, and if these kind of things happen, you have to teach them, educate them. You have to, convince them that if you get a fever, it's a good sign. It's not a bad sign. It's in fact a good sign that the vaccine is working.
Right.
So have to be explained and re-explained and need to be convinced. Their leaders. So a whole lot of IEC would be required. Lots of information, education, communication would be required in order to build an environment for vaccination. So environment building has to happen.
All right. Dr. Gupta, if I can just interrupt you for a moment. We've got another caller on the line. But before that, before I go to our caller, Dr. Seth, you had something you wanted to say? On this issue? Please go ahead.
Thank you very much for this opportunity. You see, it is vaccination of the masses here, and it's not just Delhi, Maharashtra, but to the remotest villages, these vaccines have to reach. And I've had a lot of experience on vaccine acceptance research in aspirational districts. Now, there are poor, backward districts where the doctor was talking about poverty, literacy, ignorance. So we will have to address those social determinants of health. And let me tell you about Mewat, which is very close to Delhi and where I live. And the Mewat Health Department is already, having a lot of trainings and also outreach. There are posters, there are banners. The main thing is that they need to be told the vaccine is safe. Then in order to convince people, the entire, it's not patriarchy society out there. So you need to get the religious leaders, you have to get the sarpanch, panchayats, you need to have focus group discussions with the families, the village elders, the parental, and not just women, and obviously it's not children now. So there are a lot of mass awareness. Also, there'll be a lot of fake news. Once the MR vaccine was going on, there was certainly this fake news that MR vaccine is going to cause you impotency or something very silly as that. And the government of Mewat had to actually stop and halt and actually spend a week or more to diffuse this false narrative. So we need to be mindful. And this vaccine is safe. This message is true. And as far as the CoWIN app, which the government this is a very simple app. The registration you have to do with on your ID, and then as soon as you are registered, you get an information that you're registered. Then the second they will call you which date, which time, where you have to go, and after you get that is also it
Yes.
appears.
Yes.
So this is a very simple routine process, and I think we should not be bothered about that because the government is doing a lot of work in this regard already.
Yes, absolutely. All right, let me go across to Professor Srinath, who's joining us on the phone line from Chennai. Professor, thank you for calling in. Go ahead. What's your question?
Good evening. The question to the doctors is...
Yes, please go ahead.
Are people with high levels of cholesterol considered to be having comorbidities?
Okay.
People
all right.
with high cholesterol levels and who are on 5 milligrams tablets.
All right. Professor, thank you for calling in.
Are they considered to be, and if it's over 50?
Okay. All right. I'm just going to add another question to that. Kanaka from Mumbai has also called in, and she says that taking a medication for cancer now, when will it be appropriate for me to take the COVID vaccine? I just want to club these questions together and go across to Dr. Parikh, if you can, help us answer these questions.
Yes, quick and brief answers to both questions. To the professor's question, technically, somebody who has high cholesterol is not at disease, so there is no comorbidity. He's at risk of disease. So just having high cholesterol does not entitle one to jump the queue on the vaccine in terms of having comorbidities. And Kanaka's question, what exactly does she want to know? If you kind of just tell me, I'll give a precise answer.
She said that she is taking medication for cancer and for somebody perhaps who has a disease like cancer, when would it be appropriate, or if it would be appropriate to take the vaccine?
Yes, so that's why the question is slightly confusing. If you talk about diseases like cancer, just go ahead and take the vaccine. There's no problem, including cancer. But when she talks about the medication, some of the cancer therapies are immunosuppressive. And there they will have to do it in consultation with the oncologist or the chemotherapist, if that indeed is the treatment, to determine whether the current treatment that person is getting is compromising immunity. And, this similar question was asked to Dr. Anthony Fauci on immunocompromised patients some time ago. And, he is one of the world's experts on vaccines and immunization. And, he said, always it's better to take a vaccine than to take no vaccine at all.
Okay. Dr. Gangakekar, if I come back to you here, in terms of the kind of side effects, that is also something that, multiple people have written in asking about what kind of side effects can one expect from the vaccine?
So there is one thing which we have to remember. Majority of the serious side effects, if they are to occur, if they are associated with the vaccine, they tend to occur in first 2 months of provision of vaccine. Most of the trial results that have come have a follow-up period which is far longer. Some of them have close to about 4 months time and even beyond. Now, does that mean that I don't need to worry about side effects? You need to worry about side effects. But at the same time, you must remember, the rarer the side effect, the possibility that it could occur only in your immunization is low enough. Though people may argue, one thing which I keep on saying is, would lightning, which is there in the sky, would it fall on me? Theoretically, yes. But then at the same time, you must be able to gauge, that the risk is comparatively lower, the benefits are high. Now, the second issue is when you provide a vaccine, you tend to get local side effects. No, there would be when you give an injection, there would be some amount of pain at that site. Then you may get fever, you may get some kind of fatigue. But one must remember when you take the first dose, this is going to occur. And once it occurs, it is not only treatable, but importantly, this is transient. This may last for a day or two. But this should not deter you from taking second dose, because then you would be worried, your worry with respect to whether you have completed the dose or not would be over. Don't take half the dosages. As it is, this vaccine, we, as far as we know today, it protects you against severe disease. There is early data that is emerging about mild disease as such, but we need to try to protect you,
Right.
prevent the risk of developing any kind of adverse outcome.
Okay. All right. Our next caller is C.R. Menon from Bengaluru. C.R. Menon, thank you for calling in. Please go ahead. What's your question?
Yeah, the important question that I want to ask is, you see, this vaccination that everybody thinks is a panacea, we can do it blitzkrieg. It's not all that easy that what we feel like. Because I think that since I was involved in the manufacturing of vaccines, I can say one important factor that is being overlooked is hypersensitivity. Now, hypersensitivity reaction can happen to this new vaccines, any of those vaccines.
Right.
So this kind of training, whether we have imparted to the vaccinators, are very important. Because when we go to rural area or even semi-urban area, many of those vaccinators who are giving the vaccination may not be all that, may not be a doctor, not probably even a nurse. They are only just to give a prick. So they must definitely ask those people who are receiving the vaccination whether they are hypersensitive or not to various kind of, like for example, in penicillin cases, many people have had cases of hypersensitive reactions, anaphylactic reactions. We do not know.
Right.
So it is. So those questions, whether are we asking them? Are we training these people?
Okay, all right. I'm going to go across to Anand Bhan to answer this one. Anand Bhan, what would be your reaction or answer to C.R. Menon?
So I think Mr. Menon is absolutely right. We need to worry about these things, and that should be part of the standard operating procedures and the training protocols. It's likely that the vaccinators will indeed be oriented to these issues. There's actually supposed to be an observation period after the vaccination of around 30 minutes, which is to actually pick up on any kind of anaphylactic reaction post-vaccination. Now, some of these reactions can happen longer term also, but, these kind of serious reactions typically happen in the short term. And obviously, the people who will be vaccinating will also have gone through the kind of dry runs as we have talked about. There are training protocols already being built up. There are many health facilities where staff have already been trained. So I think we should not be too much worried about it, but obviously it's something we need to be watchful about and make sure that, and we need to make sure that all of our vaccinators are trained and oriented how to respond, and that there are backup mechanisms if someone has an adverse event of any kind, then how to handle it in a way that you're able to salvage that person.
Right, absolutely. Those are, of course, there's still a lot not known about the vaccine, and the long term, in fact, all of that will only come in as time goes by. But I want to just pick up on another point, another study that was conducted, which talks about the transiently airborne nature of COVID, or the possibility that it could be transiently airborne. And Dr. Parikh, if I can come to you here, what can you tell us about this? Because this is a study that has been conducted. There were 64 air samples from different locations in 6 hospitals that were taken into account. 17 samples were collected from closed rooms that were occupied by infected people. And this study then says that, there could be a possibility that COVID might be airborne. What was your reaction or explanation for this?
Well, I've gone through the study, and I'm glad you brought it up. There is a precedent to this study, and that goes back to the 1940s, where an interpreted researcher at Harvard called Dr. Wells had looked at what happens as a droplet with viruses comes to the floor. And he actually plotted a curve which is known as the Wells evaporation curve, and showing that depending on three variables, which is humidity, temperature, and wind velocity, as the droplet comes down, it actually shrinks in size. So you have gravity pulling it down, and you have three other forces which make it smaller and then make it airborne. So this study was done. Now the current study that has been done has shown that it also depends on the viral load of the person who's infected, that indeed for more than 2 hours, the airborne particles can linger around. So this has always been known. In between, the WHO had dithered over it, and a lot of us were very emphatic that this is something we need to care for. What is the solution for it? Well, the solution, like for the question that was asked about hypersensitivity, is not so much in alerting people, but being ready with an answer. So for hypersensitivity, you just don't need to alert people. You need to have steroids. You need to have everything ready at the site to deal with it, because it's not as rare as lightning. And if it happens, we have to be prepared to treat with it. Here also, all it means is that there has to be sampling. There has to be, positive pressure. There are multiple things that are already being done to take care of it. Quite clearly in the sites in which the study was done, I believe there were 5 or 6 sites which were involved.
Right.
The measures were not adequate. So it's an important study.
All right. On that note, I'm afraid we're completely out of time on this edition. I'd like to thank all my panelists for joining in today and answering all of those questions. And I'm afraid we couldn't take many questions that have been coming in. Our phones have been ringing off the hook. But I do promise our viewers that we will continue to do more such shows where we take up all your questions. We get you the experts who will help you understand, allay all your concerns and fears. And we'll keep answering all of these questions and do everything we can to create as much awareness surrounding the vaccine. But on that note, it's time to wrap up this edition of The Urban Debate. Thanks for watching.